So November 2012 EMS training will cover some discussion about psych patient suicide calls. And although we think those increased during the holidays, we'll give you some information that that's not really true, but at any rate, it seems like an appropriate thing to talk about. And then we'll talk about that first ice and snow, which we have yet to have, but it can't be very far away. That usually brings on a number of slips, trips, and falls, a number of orthopedic injuries. We review that. And then we have a little bit of time to discuss at the station level your safety and winter operations in general. So any day now we'll have our first ice and snow. That will bring on a rash of minor and sometimes major car accidents. Sometimes those are multiple cars. Sometimes they're just single car slide-offs. Typically there's multiple cars at the same time in a similar area. So we want to give time for the station leadership to talk about how we deal with that from a safety standpoint, how we're going to mark those cars to hopefully prevent multiple calls for the same event. Then some also discussion about use of chains on the apparatus, other apparatus related winter issues, and then our POV response and some safety measures that we can take as a group for when we respond in private vehicles. So in our final session for 2012, we're going to introduce kind of a different format that we're going to use for 2013. It involves a worksheet that you will be able to use to kind of test what knowledge you have beforehand. Most adult learners enjoy integrating what they've previously learned with new material or a review of material that we're going to talk about. So we'll implement that this month with the worksheet that I handed out at your station. And then at the end of the session, there's a written assessment, and that's necessary by the rules for us to conduct a continuing ed program and allocate CEUs. So we'll need to start doing that in 2013, and we thought we'd just go ahead and begin that with the final session of 2012. So there'll be a couple of videos. One will be on staging, suicide calls, those sorts of issues. Next one will be about slips, trips, and falls, so the treatment of musculoskeletal injuries. And then there'll be time at the end for your stations to discuss as a group your specifics on winter operations in your area, both POV response and apparatus response.